the emergency department, where your journey begins. This is Dr. G, and welcome to ICU Confidential. While technically an outpatient area, the emergency department, or ED, is the fundamental starting point for your inpatient experience. Typically, there's an urgent care or fast track section that takes care of medical problems that can usually be fixed right there and won't require an admission to the hospital. Then there's also the high intensity treatment rooms for patients who are actively trying to die. And then there's the emergency room proper, where everybody else goes. You're usually triaged as you check in. A specialized nurse takes your vital signs, things like temperature, heart rate, blood pressure, oxygen levels, takes a brief history, and gets a general sense of how sick you are. The type and severity of complaint usually puts you into a queue in busier times, which is always. And then you wait, and wait, and wait, and wait. Then your phone dies and you wait some more. Finally, you get called in. It's like winning the lottery, except instead of a large oversized check, you get more poking and prodding and needles and so on. Once inside the ED, you're hopefully escorted to a room. Sometimes it's a hallway, sometimes it's a little corner where you're half expected to be handed a mop and told to get to work. But if you're really sick, you go to a specialized area. Things like potential heart attacks, strokes, respiratory failure will get in front of the line and into those special areas. Here, you may get more attention and priorities for certain tests. Once settled in, the ED nurse will come and ask you a whole set of questions. They check your vital signs again, maybe some EKG leads that monitor your heart rate and rhythm. Sometimes you'll even get an IV or intravenous catheter, and you may even get blood drawn in anticipation of the physician's evaluation. Finally, you get to see the physician or nurse practitioner. Now, sometimes they will do a quick once-over when you first get there. They're there to introduce themselves, sure, but they're also there to gauge how sick you are and prioritize how quickly you need to be seen and worked on. Eventually, you do get the full treatment, a full history and physical exam, labs and radiology tests to try to figure out what's going on, and then therapeutics, medications, procedures, stitches, whatever it is you need to get you better. The physician then makes a recommendation of whether you can safely go home or you have to be admitted to the hospital. If you need specialists to see you, this will require some more waiting as they come and evaluate you when they can. If you're particularly sick or have the potential to be, the ER physician calls the ICU. This is bad news because you're that sick, but it's also good news because that's where you meet my ICU team and we're there to take care of you. This is Dr. G, and welcome to ICU Confidential.